Most people think the most dangerous time of day for your heart is during exercise. But in my 20 years of clinical practice, I've seen more cardiac events, joint injuries, and dangerous blood pressure spikes happen in one specific window of time. First 10 minutes after you open your eyes. I'm Dr. Eleanor Hayes, an internal medicine physician, and after 20 years of treating patients just like you, adults over 50, over 60, over 65, I've learned something that most doctors simply don't have time to explain during a routine visit. The way you wake up in the morning can either protect your body or quietly work against it. Today, I want to walk you through the habits that are putting seniors at real risk, right there in their own bedroom before the day has even begun. And I'll give you a simple framework I use with my own patients. I call it the transition principle. Here's what it means. Your body doesn't like sudden change. It likes gradual transitions. From sleep to wakefulness, from stillness to movement, from cold to warm. When you respect that principle, your heart, your joints, your blood pressure, and even your brain all function better. When you ignore it, that's when things go wrong. Let's talk about exactly what those things are. Jumping out of bed the moment you wake up. Here's something I tell every patient over 65 who comes into my office complaining of morning dizziness or unexplained falls. I ask them one simple question. How quickly do you get out of bed in the morning? Almost every single time, the answer is the same. Oh, right away, doctor. I don't like lying around, and I understand that completely. There's a certain generation that was raised to believe staying in bed even one extra minute is laziness. I respect that deeply. Here's the medical reality. When you're asleep, your blood pressure drops, your heart rate slows, your entire cardiovascular system shifts into a kind of rest mode. That's healthy. That's exactly what sleep is supposed to do. But the moment you stand up suddenly, gravity pulls a significant amount of blood downward, away from your brain. Your heart has to scramble to compensate. For a younger person, that adjustment happens in seconds. But after 65, that response is slower. The blood vessels are less elastic. The nervous system takes longer to recalibrate. The result? A condition called orthostatic hypotension, a sudden drop in blood pressure when you stand. Dizziness, lightheadedness, and in many cases, falls. And falls, for adults over 65, are one of the leading causes of serious injury. Research published in the Journal of the American Geriatric Society confirms this risk is significantly higher in older adults, especially in the first few minutes after waking. What do I recommend instead? The 30-second rule. When you wake up, don't immediately stand. Lie still for 30 seconds. Then sit up slowly. Sit at the edge of the bed for another 30 seconds. Let your feet touch the floor. Then and only then stand up. That simple transition can protect your heart and prevent a fall every single morning. Point 2. Drinking a glass of ice-cold water first thing. Stay with me here, because this one surprises almost every patient I mention it to. Probably heard that drinking water first thing in the morning is good for you. And it is. Hydration after 7 or 8 hours of sleep is genuinely important. I'm not going to argue with that. But here's what most people don't realize. The temperature of that water matters more than you might think, especially after 65. When you're sleeping, your core body temperature drops slightly. Digestive system is at rest. Your vagus nerve, the nerve that connects your brain to your heart, lungs, and gut, is in a calm, settled state. Now imagine swallowing a large glass of ice-cold water into that quiet system. The sudden cold triggers what's called a vagal response. The vagus nerve reacts to the temperature shock. And in some people, particularly older adults with any underlying cardiac sensitivity, this can cause a brief but significant dip in heart rate. I've had patients describe it as a sudden fluttering feeling in their chest. Others feel a wave of nausea. Some feel momentarily faint. Most of the time, it passes quickly. For someone with an already compromised heart rhythm, that unnecessary jolt is something we want to avoid completely. The transition principle again. Your body doesn't like sudden change. The fix is simple. Room temperature water, or even slightly warm water with lemon, which has the added benefit of gently stimulating digestion. Keep a glass on your nightstand the night before. Let it come to room temperature naturally. One small change. A much kinder start for your cardiovascular system. Point 3. Immediately reaching, twisting, or bending without warming up. Here's what most doctors don't have time to explain, and it directly affects your joints, your spine, and your risk of injury every single morning. While you sleep, the fluid in your spinal discs, the soft cushions between your vertebrae, actually shifts. The discs rehydrate and expand slightly overnight. Your muscles are cool. Your joints are stiff. Your connective tissue hasn't had a chance to warm up and become pliable. This is why so many people over 65 throw out their back, reaching for their phone on the nightstand, or hurt their shoulder, grabbing something from a high shelf right after waking up. It's not weakness, it's biology. Research on this is consistent. The spine and major joints are at their most vulnerable in the first 20 to 30 minutes after waking. Sudden twisting, bending, or heavy reaching during this window puts real stress on structures that aren't ready for it yet. What I recommend to my patients, before you get out of bed, do 60 seconds of gentle movement while you're still lying down. Slowly bring one knee to your chest, then the other. Gently rotate your ankles, roll your shoulders, let your body know that movement is coming. Give your spine a chance to prepare. It takes less than a minute, and it can protect your back and joints far better than any supplement on the market. Point 4. Skipping the bathroom and immediately checking your phone. I know this might feel like a strange one for a medical video, but hear me out because the science here is real and it directly affects your blood pressure and your nervous system. When your alarm goes off or your eyes open naturally, what's the first thing most people do? They reach for the phone, emails, news, notifications, social media. First 60 seconds of consciousness. Here's what that does to your body. It immediately activates what we call the sympathetic nervous system, the fight or flight branch. Cortisol, which is already at its natural morning peak, gets an additional spike. Blood pressure rises, heart rate increases. Your body shifts into a stress state before you've even stood up. For adults over 65, particularly those managing hypertension, which in my practice is a majority of patients in that age group, this early morning cortisol and blood pressure spike is something we actively try to minimize. Research consistently links it to increased cardiovascular risk. I tell my patients, give yourself a 10-minute phone-free window every morning. 10 minutes to breathe, hydrate, do your gentle movements, and get upright slowly. Let your nervous system wake up on its own terms. The emails will still be there. News will still be there. Your heart will thank you for the patience. Point 5. Skipping breakfast or eating the wrong thing too fast. Now, here's the one that surprises most of my patients the most, especially those who've been told that intermittent fasting is healthy. Intermittent fasting may have benefits for certain people under certain conditions, but for adults over 65, skipping breakfast or rushing through it while standing over the kitchen counter can create a blood sugar pattern that stresses the cardiovascular system. After a full night of sleep, your blood glucose is at its lowest point of the day. If you skip breakfast entirely or eat something high in simple sugar very quickly, you create a sharp spike and drop in blood glucose. In older adults, the body's ability to regulate that spike is less efficient. That roller coaster, low, high, crashing low again, is hard on the heart, hard on energy levels, and linked to increased cognitive fatigue throughout the day. What does a good morning meal look like? I keep it simple for my patients. Protein, fiber, a small amount of healthy fat, eaten slowly, sitting down, not rushed, not scrolled through. A meal that tells your body the day is beginning gently. We are in good hands. Point 6. The surprise insight. Your morning breathing patterns save this one because almost no one talks about it, and yet it may be one of the most powerful things you do all day. First few minutes of waking, most people breathe shallowly and quickly without realizing it, particularly if they had disrupted sleep or woke abruptly from an alarm. This shallow breathing keeps the body in a mild state of physiological stress. Here's what I recommend, and what research on heart rate variability consistently supports. 3 slow, deep breaths before you get out of bed. Inhale for 4 counts, hold for 2, exhale for 6. That just 3 times. It activates the parasympathetic nervous system. It lowers cortisol. It steadies heart rate. It signals to every organ in your body, we are safe, we are calm, we are beginning this day with intention. 3 breaths, free, available to you every single morning for the rest of your life. Before I close, here are 3 smart questions I'd encourage you to bring your next doctor's appointment. 1. Do I have any signs of orthostatic hypotension, and should I be taking extra care when I stand up in the mornings? 2. Given my current medications and blood pressure, is there anything specific I should or shouldn't do in the first 30 minutes after waking? 3. Is my current morning routine, including what I eat and drink first, working with my cardiovascular health or against it? These are the kinds of questions that open real conversations, and real conversations lead to better care. The transition principle, remember it, your body doesn't like sudden change. It likes to be guided, gently, deliberately, with patience. After 65, the morning is not just the start of your day. It's an opportunity to set the tone for your heart, your joints, your blood pressure, and your mind. You don't have to overhaul your life. You just have to slow down for 10 minutes. Give your body the transition it deserves. If this video helped you, please subscribe. Every week, I share research-backed health insights that you simply won't get in a 10-minute doctor's appointment. And share this with someone you love who is over 65, because these small habits matter more than most people realize. Take good care of yourself. I mean that. This video is for educational purposes only and does not replace the advice of your personal physician. Always consult your doctor before making changes to your health routine.